Hello everyone, you are welcome to the University of Nigeria Teaching Hospital Health Education Series. The Health Education Series is a collection of videos that provide the public with information on simple, practical, and important ways to ensure that everyone remains healthy. My name is Professor Amechi Nwobi, a public health physician and head of Department of Community Medicine, and today I will be discussing the topic Human Immunodeficiency Virus, HIV. Now, what is HIV? HIV stands for Human Immunodeficiency Virus. It is a germ that destroys important cells within the human body that helps the body to fight infections, different types of infections. If one gets infected with HIV and is untreated, the HIV progressively destroys these cells called CD4 cells, which are also known as soldiers of the body. It will get to a critical level, a level where they are few in number within the body, that when any other infection sets in, the body will not have the ability to fight the infection. And when the cells are intact, the CD4 cells that fight infections are intact, they also fight cancer cells when they attempt to begin to replicate within the body. In essence, the HIV does not kill directly, but does so indirectly by creating room for other infections to be established within the human body and lead to disease states that will now destroy different body systems that may lead to death. Now, it is at the point where an individual develops these symptoms as a result of other infections that the individual can be said to have AIDS, acquired immune deficiency syndrome. Now, how can an individual get infected with HIV? The key thing is that the infection is spread through contact with infected body fluids coming from the human body, which may be saliva, which may be blood, which may be semen, which may be vaginal fluid, or even breast milk. Now, infection can pass from person to person through sexual intercourse between an infected person and an uninfected person. Infection can also be transmitted through sharing sharp instruments like needles and syringes that are contaminated, either in normal treatment in the hospital or in injecting hard drugs Other sharp instruments that can transmit this virus are clippers that we use in shaving our heads, razors, and nail cutters. And then the other means of transmission is from mother to child. During pregnancy, during childbirth, and at breastfeeding. The commonest thing in mother to child transmission is during delivery, and following that during breastfeeding. Now, with the control efforts the government is making and the health system is making, the number of infections and the number of full-blown AIDS cases have reduced, but we notice that the number of new infections are still significant. So, HIV/AIDS is still a public health problem. So, how do we protect ourselves from getting infected? The key thing is abstinence from sex when you are not married, and then maintaining fidelity to your spouse, your husband or your wife, as the case may be, if you are married. Now, the habit of having multiple sexual partners, many partners, increases an individual's chance of getting exposed to a partner that is infected. Now, if you must have sex outside marriage, then it is advised that you use condom. Much as condom is not foolproof, the condom can break and you might still get infected, but condoms reduce the frequency of infection. Now, for prevention of mother-to-child transmission, it is important that when pregnant, that women should go for HIV testing. If they test positive, there are special drugs that are administered to them throughout pregnancy to prevent the transmission from the mother to the child. Now, at the point of delivery, there are precautions the health workers, the midwife, and the doctors will take, and there are medications that will be given to the child upon delivery. If you are HIV positive, it is advisable that you don't breastfeed the child. And most importantly, for everybody, be faithful to your partner, to your spouse, and abstain from premarital sex. When we do all this, we will be safe and protected. Now, one last bit of information you need to know is that we have what is called post-exposure prophylaxis, which is available in hospitals for health workers who, in the course of handling patients that are infected, get injured either by surgical blades or needles in the course of their duty. Within 72 hours of that injury, if they take the post-exposure prophylaxis, according to the recommendation, the chances of the HIV getting established in their body is reduced. And then when people are raped, there is also available for them post-exposure prophylaxis. In summary, we have looked at what HIV is: an infection that destroys the body's ability to fight infection, and that it is possible to protect ourselves from getting infected by HIV, and we can live a healthy life if we get infected by making use of available treatments, especially the pregnant women, to protect their children from getting infected. So, live healthy, stay HIV free, and we will have a HIV free world. If you have any questions, there is a number on the screen. You can call that number for clarification. Once again, I am Professor Amechi Nwobi, the Head of Department of Community Medicine, UNTH. Thank you.